Hi everybody, welcome back to the Dr. Sia channel. Today I want to talk to you about what's good therapy. Too many times I've heard people talk about they've gone to therapy and it's been useless to them or they've got nothing out of it. I thought to myself, all right, enough is enough. Here are 4 things that make therapy really good. Let's get started. All right, so what are the 4 things that make therapy good? So for therapy to be good, one of the things that has to be there is that therapy has to help you somehow improve your self-awareness. That means your self-awareness means your awareness about yourself, your behaviors, your thoughts, and your feelings. If therapy is not improving this thing called insight, you're probably not receiving a really good therapy. Now, the second thing that therapy is meant to do is help you find the cause of your problems. And I don't mean like the bigger cause. I don't mean an existential cause. I just mean like things that actually cause your problem. It doesn't need to be the one thing that causes your problem, and often it can be many things that cause one problem, but good therapy helps you find the cause of your problem. Now, the third thing that needs to be there for it to be good therapy is that you need to know what patterns you have, what you tend to do, what that tends to be the outcome of the problems that you have. So, for example, if I'm anxious and I get really scared in social situations, the consequence of that tends to be that I tend to avoid. And when I tend to avoid those social situations, because of that, I tend to have lesser friends, less enjoyment, etc., etc. So you need to know the consequence of what happens, the outcome of these problems. And finally, and what some would say is probably the most important, is therapy needs to help you improve your self-care. Without improving your self-care, and I mean psychological self-care, and if you haven't seen my video on psychological self-care, please, I'll link it up right here right now. Like I'm talking about psychological self-care, it needs to help you improve your kindness to you. It needs to help you have better thoughts or more effective thoughts or more helpful thoughts. It needs to help you be more okay with the feelings that you have, be less judgmental towards yourself. It needs to help you engage in healthier behaviors. So if therapy is not doing that, then really, even though you've known more about yourself, or even though if you learn more about the causes and the outcomes of your problems, if you're not really engaging in helping yourself more, then again, you might not be receiving really good therapy. Now, with that said, when I say receiving really good therapy, I don't mean that the therapist isn't doing their job. I just mean that maybe perhaps between the two of you, there are some things that you don't agree on and things are not happening. Sometimes we experience resistance and we're not feeling better because some part of us is not allowing us to feel better. And I'm going to make another video on resistance. So if you're interested about what resistance is, let me know in the, in the link down below. And that's about it. That's my really quick spiel on good therapy. I hope you liked. I hope you enjoyed. I'll see you around next time. I think I'm going to have to cut out some... I'm losing my voice for some reason as we go on. Okay, I'll see you next time. Please subscribe. Remember to subscribe.